Hi everyone, this is Dr. Merhaut from Elite Sports and Spine Chiropractic. Today I'm going to be going over golfer's elbow and tennis elbow, which is also known as medial and lateral epicondylitis. So first off, what is medial and lateral epicondylitis? Medial and lateral epicondylitis, they tend to be a tendonitis, which is a muscle or tendon strain. So with a muscle tendon strain, there's three different grades: grade 1, grade 2, and grade 3. Grade 1 strain is when those fibers just pull apart a little bit. It could be due to overstretch, it could be due to repetitive use within that area. Grade 1 is when there are some small tears within that muscle or tendon itself. And then a grade 3 would be a complete tear of that muscle or tendon. So the medial and lateral epicondylitis usually range between the grade 1 and grade 2 tendonitis. So with that, it's usually a repetitive injury over time. It's not often a real acute injury, so we would call this a chronic type of injury. If it were to be an acute injury, just the way it would happen would be if we were to talk about the golfer's elbow, which would be the medial epicondylitis. If this were to happen, it would be for the case of a golfer swinging and chunking it into the sand or the dirt or grass, and then straining that muscle of the tendon on the inside of the elbow. So that would be an example of more so an acute injury for medial epicondylitis or golfer's elbow. Now, you don't have to be a golfer to get golfer's elbow. You don't have to be a tennis player to have tennis elbow. Anybody can really get this. We see this a lot with people that use their hands a lot. So industrial workers, people who are doing a lot of lifting. We see this in athletes that do a lot of lifting as they're training. We also see it in people that have had previous shoulder injuries. So I'll talk a little bit about why you would have why there would be medial or lateral epicondylitis and a shoulder injury a little bit later. So common reasons why it's more of a chronic injury, that repetitive strain of the inside or the outside of the elbow. If it's the inside of the elbow, it's more so the wrist flexion type of motions that's putting that strain and that stress on the inside of the elbow. If it's lateral epicondylitis, it's going to be that extension, more so kind of like revving the motorcycle on the outside. So your extensors are going to be what's strained in that case. So with that, the repetitive type of motions, that can just be carrying things for an extended period of time. That can be typing on the computer and having the wrists extended for an extended period of time. It doesn't have to be anything strenuous. It just has to be something repetitive over and over throughout the course of whenever your injury is developing. So common things that we'll see with medial and lateral epicondylitis on a way to almost self-diagnosis is a real easy self-diagnosis. Most people can come in the office and say, yeah, I think I got medial epicondylitis, or I think I got lateral epicondylitis, golfer's elbow, tennis elbow. So with that, if we're looking on the lateral aspect on the outside of the elbow, if you simply bring your wrist towards your elbow and then you press down and try to resist that motion, that puts stress on the outside of the elbow. So if you're getting pain on the outside of the elbow when you're resisting that motion, that's a pretty easy test to tell if there's some irritation or inflammation within that area. Tendonitis is an inflammatory diagnosis, so a lot of the times the inflammation is what's causing a lot of that pain, whether it's on the outside or the inside of the elbow. For the medial epicondylitis, the easy test is making a fist, flexing it forward, kind of like you're doing a bicep curl but within the wrist, and then pressing down away from you. And if there's pain or tenderness within the inside of the elbow, then that's a pretty easy way to tell if you have some inflammation. Could potentially be the medial epicondylitis or golfer's elbow that we've been talking about. So common things that we do for medial and or lateral epicondylitis, or any tendonitis in general. I mean, there's tendonitis all throughout the body, but today we're focusing on the medial and lateral epicondylitis in the elbow. So with that, we usually recommend icing. Icing is important just because it's an inflammatory process within that area. So icing that helps decrease some of the inflammation, helps decrease some of the pain response in general. There's what we call transverse friction massage. So what that means is there's some muscle work, some muscle release done to the area and done to the tendon itself. This can be done manually with the thumbs or fingers. It can be done with a little tool, a soft tissue tool. Some people call that scraping. It can also be done with a couple other different methods, whether it's to stretch the area or just to get that muscle released. So transverse friction massage to the outside, the inside of the elbow, wherever the epicondylitis is. That's where we'll usually do that. That kind of helps break up some of the adhesions. It helps decrease some of the inflammation into the area. And then we do other things to help support that area. So one of the things we do to support the area commonly is we'll use kinesio tape. So kinesio tape can be applied to that area to help promote a certain motion, to help take a little bit of stress off that area, whether it's on the inside or the outside. It can also help as a little bit of a stabilizer to that area as it heals. Other things that we implement are therapeutic exercises. So with the rehabilitation exercises, normally there are certain muscles that you want to strengthen, and certain muscles you want to stretch, and then other muscles that need to be released because they're too tense and tight, or there's trigger points within a muscle group that needs to be released. So there's all different kinds of muscle releases out there. We do both static, which means a pressure release, as well as an active release. And an active release is really beneficial where you're releasing the muscle as you're putting in the joint through a certain range of motion, and you're putting that muscle through a range of motion to help with the relaxation of that muscle tissue. So those couple things, kinesio taping, muscle releases, therapeutic exercises, and stretching, those are things that all help with the healing process of the medial and lateral epicondylitis. Another thing that we will implement in the office is what we call our K laser. This is a class 4 laser. Basically what we use for decreasing the inflammation process, speeding up the healing time of the tissue. So those tissues, if there are little micro tears within it, they need to kind of realign and get back to where they need to be so that muscle and tendon can be strong, so you're not re-injuring it over and over again. Like I said previous to, these are usually repetitive type injuries, so if you don't do anything about it, it's just going to keep coming back over and over again. The other thing that we see is a common thing that some people don't look at is thoracic mobility and shoulder mobility. I talked a little bit about how some people that have shoulder injuries tend to get some type of tendonitis or epicondylitis down the road. So with this, just think of lack of motion in one area. Another area has to compensate for that lack of motion. So whether it's in the shoulder or the thoracic spine, I'm going to use a golfer for example. So with a golf swing, you have to have a certain amount of rotation in order to go through your whole golf swing. If you have lack of rotation, a lot of that rotation comes from the thoracic spine, so the mid-back. If you have lack of rotation in that area, there are areas in the body that have to compensate for that. So whether it's compensated for in the shoulder, whether it's compensated in the elbow, the wrist, or even the low back. Other areas have to work a little bit harder because there's lack of motion in another area. So to go along the same lines of that lack of motion in the thoracic spine, so if you have limited rotation, as you're following through with your golf swing, you're trying to gain speed, you're trying to gain power with that swing. So if you're not rotating enough to get get the club all the way through, then you're going to be gripping harder and using the forearm muscles to help pull and create that force and torque you need in order to hit the golf ball. So that's a common thing that we'll see. It's just an example with golfers, but you can see this in any athlete where there's any type of rotation and relating to the thoracic rotation potentially causing something where the shoulder has to compensate or the elbow has to compensate. So that's one explanation of why someone may develop epicondylitis, whether it's medial and or lateral. I could go through the same thing with an example of a tennis athlete, but it would just be the opposite motion, kind of like a backhand. If they're not having proper shoulder mobility or proper thoracic mobility, then we're seeing that it can potentially lead to some type of epicondylitis within the elbow. So I won't go into shoulder and back injuries, but because we're talking about medial and lateral epicondylitis. But one thing we'll commonly do if someone comes in with the medial or lateral epicondylitis is we'll also look at the shoulder. We'll also look at the thoracic spine. We'll look at mobility. We'll look at range of motion. We'll look at muscle balance between all those areas to make sure that there's not a weakness in one area that's causing the problem, which is in the elbow. Oftentimes we'll have pain in one area, but the dysfunction will be in another area. So we look at other areas, we don't just look where the pain is. That's one of the big mistakes that some practitioners make, is they look where the pain is and they just treat the pain. If you just treat the pain, yeah, it'll feel good for a little bit, but down the road it'll just keep coming back and back. So you have to find the root of the cause, which for medial and lateral epicondylitis is oftentimes in the shoulder and in the thoracic spine. So that's what we look to treat, and that's something that's very, very common that we see in athletes and then just industrial workers in general. So back to my upper cross presentation a couple weeks ago. Upper cross can be related to medial and lateral epicondylitis, so posture in general. If you go back and listen to that video, you'll see how shoulder mobility can be affected by upper cross syndrome, and then that in turn will relate to elbow pain down the road. So if you know anybody that has medial or lateral epicondylitis, golfer's elbow, tennis elbow, they've been dealing with it for a long time, feel free to share this video with them. This is our Elite Education series, this one being on medial and lateral epicondylitis. My name is Dr. Merhaut. I hope you join me next week for our next series. If you have any requests on certain topics, or if you have questions on any of the topics that we've already done, please comment in the comment box. But we look forward to seeing you again next week.